Personalized medicine is really important in oncology because we're discovering that tumor types are not just a single tumor or a couple of different histotypes for a particular tissue, but really a number of different kinds of tumors. And they're characterized more by their markers than by their appearance under the microscope. The other important thing about finding out the right kind of tumor that you have and getting to the right treatment is that the tumors change with treatment. They change over time, and so a treated tumor is different than an untreated tumor. And so being able to find those new markers or other things that have changed within that tumor can help lead to better second and third line therapies for that individual patient. How that changes depends on the treatment that has been chosen as the first line therapy. So there's no longer a one-size-fits-all in oncology in many different areas. There are a lot of unmet needs in oncology. You can list those unmet needs by tumor type. We still need really good approaches to pancreatic cancer, for example. But we also have to understand things like pancreatic cancer. There are patients with pancreatic cancer who live much longer than patients are expected to live with pancreatic cancer. Clearly they have a different tumor. And there's something different about prostate cancer that arises in somebody who's 50 years old versus somebody who's 80 years old. It's really going to be useful to understand more those sort of tumor types and how we can particularly deal with those patients. But without personalized medicine, without genomics, without marker detection, we would still have an enormous number of treatments, and actually a burgeoning number of treatments, and we just wouldn't know which one to use for a particular patient. So you would be taking a guess based on the epidemiology, based on the demographics of the patient, and that's really not sufficient because it really isn't about the patient's epidemiology, where they fit, or their demographics. It's really about their genes and the genetics of the tumors that they suffer from.